Liver disease is quite common, and liver problems may proceed slowly, leading to serious complications if not treated immediately. Liver failure, liver cancer, cirrhosis, hepatitis, and fatty liver disease are some of the most serious liver illnesses. Therefore, early detection and treatment of liver diseases are critical. Here are some signs that you may be suffering from a significant liver condition. Let's have a look at what these symptoms include. Don't forget to tell your loved ones how to avoid and cure liver disease early. Support our channel by liking and subscribing. 1. Palm erythema. One easily recognizable sign often associated with liver damage is palm erythema. When the liver is damaged, leading to impaired liver function, the blood vessels in the palms of the patient tend to dilate more, causing redness in the palm of the hand. This is a common symptom of chronic liver diseases such as cirrhosis and liver cancer. Specifically, the patient's red palms or erythema will appear as follows. The patient's fingertips are red, but their palm is white. Because of this contrast, palm erythema is easily seen. The palm feels warm. When pressure is applied to the skin of the palm, the patient experiences no discomfort and the skin turns white. However, as the pressure is released, the patient's skin returns to its typical red color. The red dots are often regular and do not cause irritation. However, palm erythema can also indicate various diseases such as poor quality arthritis, pregnancy in women, and so on. Now check your palms for indicators of palm erythema, such as those listed above. If you detect any, please call a healthcare facility for prompt examination and treatment. 2. Jaundice. In addition to palm erythema, jaundice is a crucial symptom of liver disease that you should be aware of. The cause of this condition is decreased liver function, which leads to insufficient metabolism and removal of the blood pigment jaundice. The accumulation of jaundice in the blood causes yellowing of the eyes and skin. Jaundice should be seen in natural sunlight and in covered areas like the tummy, back, and chest, rather than on the exposed skin of the hands, feet, or face. It frequently comes out as a sign of serious conditions when combined with other symptoms. Common symptoms may include fever and chills, pain in the lower right or upper abdomen, itchy skin, particularly at night with obvious scratch scars on it, unintentional weight loss, weakness, and loss of appetite, easy bruising or bleeding, for example, nosebleeds, gum bleeding, vomiting blood, pale feces, dark-colored urine. Note: it's important to differentiate jaundice from pseudojaundice caused by consuming a large amount of beta-carotene-rich foods, such as carrots, pumpkins, and some melons. In this situation, the skin may appear slightly yellow, but the eyes remain clear. This condition is not jaundice and is unrelated to liver or bile duct diseases. If you discover signs of jaundice in your skin or eyes, seek medical care right away before it is too late. 3. Spider angioma signs. Spider angioma is a noticeable symptom of liver disease. Spider angioma is a raised, spider-like vein on the skin with a central arteriole and branching out surrounding small blood vessels. A spider angioma is usually less than 1 centimeter in diameter and appears reddish. A spider angioma vanishes when pressure is applied to its surface, and fresh blood continues to flow into the surrounding tiny vessels even when the primary arteriole is not compressed. Spider angiomas can form anywhere in the body, including the face, beneath the eyes, above the cheekbone, palms, arms, and shoulders. Spider angioma is a medical use that doctors apply as proof of early diagnoses of liver illnesses. Spider angiomas and hepatitis C can predict disease development. Some of the causes of spider angioma production are: the formation of spider angiomas is due to an increase in estrogen in the blood, leading to vessel dilation and blood stagnation, making them visible under the skin. Spider angiomas can develop in women during pregnancy or when taking birth control pills, but they usually go away after childbirth or when the drug is stopped. Use of certain vasodilating substances such as histamine, serotonin, and being trapped in the bloodstream. It occurs occasionally in the elderly, but very rarely due to hormonal causes. Fatty liver disease occurs when the liver accumulates an excessive quantity of fat, which typically exceeds 5% of the total liver weight. Hepatitis. Hepatitis caused by viruses such as hepatitis B, hepatitis C often present with spider angiomas. However, these signs appear on the chest, face, and neck, not on the abdomen and lower extremities. Additionally, in hepatitis C, spider angiomas also indicate the progression of the disease. Cirrhosis. Liver cirrhosis reduces the breakdown time of estrogen in the blood, resulting in the formation of spider angiomas. This is also a hallmark sign of patients with cirrhosis. It is an extremely serious disease for patients, resulting in impaired liver function, difficult treatment, and a high fatality rate, highlighting the importance of spider angiomas in detecting this condition. Spider angiomas can also arise in patients with low-grade arthritis, toxic goiters, and other conditions. If you discover spider angiomas, you may be experiencing health problems, particularly with your liver. As a result, seek urgent medical assessment and treatment. 4. Easily bruised and bleeding skin. This symptom is common in a variety of other conditions, including diabetes, blood disorders, vitamin deficiencies such as C, B12, K, and P, hormonal imbalances, and excessive use of certain medications such as aspirin, contraceptives, antidepressants, pain relievers, anti-inflammatory drugs, blood thinners, iron-containing medications, or long-term asthma medications. However, one of the more serious reasons is liver disease. The liver plays a role in releasing essential proteins for the blood clotting process. When the liver is damaged, these proteins decrease, making bruising more likely to occur. Individuals with liver disease may bruise easily even with minor collisions. This syndrome is most typically seen in those who have severe liver disorders. Easy bruising is a common outward indication of liver disease. 5. Itchy sensation blisters, red rashes, and itching on the skin are common symptoms of liver-related itching. The red rash patches have distinct boundaries, with little red spots initially developing to larger areas. In severe situations, the red spots can spread throughout the body, feeling hard and dense to the touch. The red areas on the skin usually fade within a few hours, when the body no longer feels cold. The itchy feeling frequently lasts along with a warm sensation throughout the body, which worsens when the surrounding temperature drops rapidly, such as during rain or windy weather. This is also a discerning feature that helps differentiate liver-related itching with rashes from other dermatological conditions. Itching can accompany other symptoms of liver diseases, including fatigue, pain, and mood changes, reduced appetite, bad eating habits, and indigestion. Dull or throbbing discomfort in the lower right abdomen, which can sometimes spread to the right shoulder. Yellow skin and eyes, dark urine with or without pale stool. Gums bleed, and bruising appears easily on the skin after touch. These symptoms provide clues to the possible cause and the severity of the disease. If liver illness is not recognized and treated early, it can progress to chronic liver dysfunction and potentially cirrhosis. As a result, if you experience any strange symptoms, you should get medical attention at a healthcare facility to diagnose the problem, determine the source, and receive timely treatment. 6. Breath odor. Breath odor is not only a warning indicator of oral health difficulties, but it can also indicate liver disease. When the liver is unable to filter waste products such as ammonia and urea out of the blood, these compounds continue to travel through the bloodstream to other organs in the body, including the lungs, causing your breath to smell. At this time, the patient's breath may smell unpleasant due to an increase in the organic complex dimethyl sulfide, which is a result of sulfur-containing amino acids that have not been effectively filtered from the blood. The worse the smell, the more likely the liver's function will be affected. 7. Facial skin has several dark spots. The seventh indicator that you may have a liver-related issue is a change in skin pigmentation or the appearance of extra black spots on the face. Specifically, when the liver is injured, estrogen levels may rise. This leads to the enzyme tyrosinase producing more melanin, causing an increase in pigmentation and the appearance of more dark spots on the patient's face. However, many patients mistake this symptom for sunburn or skin pigmentation issues. 8. Nausea. When liver function decreases, the liver is unable to properly remove toxins from the body, resulting in an accumulation of harmful compounds in the blood and nausea. However, this is a common sign of numerous gastrointestinal illnesses. As a result, an accurate diagnosis requires a combination of additional, more common signs and symptoms. 9. Changes in stool and urine color. If your stool is lighter in color, it could be a sign of liver-related conditions. Another sign of gastrointestinal bleeding is black or bloody stool, which could be caused by liver cirrhosis or liver cancer, resulting in increased pressure in the digestive tract's blood vessels. To discover the actual source of these symptoms, visit a doctor and perform the recommended testing. Additionally, excessively dark urine may be caused by a buildup of excess bilirubin due to inadequate liver processing. 10. Lack of concentration and fatigue. This is a symptom of liver illness that is frequently ignored. Many people attribute fatigue or lack of concentration to excessive workload or other illnesses. However, it may also be a sign of a liver disease. As you are aware, the liver's major role is to cleanse and supply energy to the body. When the liver fails to perform its functions effectively, it can adversely affect the brain and, coupled with poor energy metabolism, can lead to fatigue and lack of concentration. The 10 symptoms listed above indicate that you may have a liver issue. Check to see if you have any of these symptoms, and if so, attend a healthcare facility right away for blood testing and imaging diagnostic procedures to ensure the most accurate diagnosis. If you find this video useful, please share it with your friends and family so that diseases can be prevented and treated in time. Don't forget to like and subscribe to our channel to remain up to speed on the latest health videos.